Well, I think the key to realize is that you're really treating the underlying disease. That although patients can have different ways they're affected, anemia, low platelets, enlarged spleen, symptoms, these are not individual things that we treat, but that we're really trying to treat the whole disease. So with that, for many individuals, if we can treat everything with a single drug, we would. So now that we have Momelotinib, which has been approved, that can help to have a direct impact on spleen symptoms and anemia, that can be a very unifying sort of therapy for the disease. I like to tell folks Momelotinib is a myelofibrosis drug. It's not an anemia drug, but it's a myelofibrosis drug that can help to improve anemia. Now, there's also benefit that can be seen with pacritinib. Pacritinib has an indication particularly for those with thrombocytopenia, but anemia benefit can also really be seen. Now, combinations have also been used, particularly for individuals who are on ruxolitinib or fedratinib, erythropoietin-stimulating agents, luspatercept in clinical trials, as well as other approaches to try to impact and improve anemia. As we look at future combinations with BET inhibition and JAK inhibition or other combination approaches, we hope again for more of a unifying sort of approach, as opposed to, there's 4 ways that patients are affected. We use a drug to treat each. I think really unifying approaches are best.